Imagine waking up to an intense, burning itch. Within minutes, your skin erupts in agonizing, raised red welts that spread organically across your body. If this reaction lasts for less than 6 weeks, dermatologists classify it as acute urticaria. Usually, the culprit is easy to spot, a true immune-mediated allergic reaction to something like peanuts or shellfish. But if those hives keep returning for more than 6 weeks, the diagnosis changes to chronic urticaria, and the frustration begins. In up to 95% of these chronic cases, doctors cannot identify a specific environmental or dietary trigger. Despite this lack of clinical evidence, nearly a third of patients blame their daily meals for the flare-ups. They start cutting out foods, eventually whittling their diets down to the bare bones. These blind dietary restrictions rarely cure the hives. Instead, research shows that inappropriate food restriction without medical evidence leads to severe psychological burden and dangerous nutrient insufficiencies. Conquering chronic hives requires abandoning blind restriction. Dermatological data points toward a highly targeted clinical framework instead. We call it the dietary equation of subtraction versus addition. Let's look at the subtraction half of the equation first. Patients need to stop hunting for traditional food allergies and focus instead on hidden chemical irritants. Artificial dyes and preservatives act as pseudoallergens. They bypass the antibody response, directly provoking hypersensitive immune pathways. The body also faces metabolic bottlenecks from high histamine foods. When gut enzymes cannot keep up, histamine accumulates. A low-histamine diet measurably reduced symptoms in 75% of patients. Beyond common chemical irritants, clinical literature documents bizarre, emerging dietary triggers that perfectly mimic chronic urticaria in highly specific environments. For example, a single bite from the Lone Star tick can inject a sugar molecule called alpha-gal that rewrites the human immune system. Suddenly, the body violently rejects mammalian meat, causing hives and anaphylaxis hours after a meal. Or consider wheat-dependent, exercise-induced anaphylaxis. Intense physical exercise uniquely interacts with digested wheat proteins in the gut, inducing severe, hive-producing reactions in adults. Identifying and removing these specific triggers will halt flare-ups, but endless food subtraction is a trap, unless it is paired with systemic biological fortification. This brings us to the addition half of the equation. We have to shift our focus away from the gut and look at repairing the immune system's missing building blocks. A recent meta-analysis demonstrates a severe correlation between adult chronic urticaria and critically low levels of vitamin D. Biologically, high-dose vitamin D binds to rapidly vibrating mast cells. This connection slows their differentiation, stabilizing the cell and halting the release of inflammatory chemicals. Iron plays a similarly structural role. In patients who were poorly responsive to standard treatments, correcting their iron deficiency anemia completely cured or massively improved hives in 2/3 of the group. Specific dietary fats also calm the skin. Patients with aspirin-induced urticaria have elevated levels of arachidonic acid in their blood. Supplementing with omega-3-rich fish oils directly combats the pro-inflammatory leukotrienes generated by that acid. Finally, plant-based phytonutrients known as flavonoids, specifically quercetin and luteolin, decrease allergic cytokines, acting as natural biological antihistamines at the cellular level. Fortifying the body against systemic inflammation through targeted nutrition is frequently more powerful than attempting to starve it of potential triggers. Yet standard patient behavior often ignores this balance. Major allergy organizations explicitly warn against expansive, permanent dietary restrictions. The clinical best practice is precise. A strict elimination of pseudoallergens and histamines should be utilized solely as a temporary diagnostic tool. If skin symptoms do not definitively improve after a 4-week trial, the restrictive diet must be abandoned to preserve the patient's long-term metabolic health. While executing that brief elimination trial, patients should simultaneously request blood panels to test for hidden vitamin D and iron deficiencies. Food is a diagnostic tool, not an enemy. By mastering the dietary equation, subtracting specific irritants and adding vital structural nutrients, patients can restore their skin health without sacrificing their quality of life. Thanks for watching, and be sure to subscribe for more deep dives into clinical biology.